Okay, so everyone, welcome to our side event. It's a side event that was proposed by WONCA, that is the World Organization of Family Doctors. So Anna, you have to help me admit people as they come in. Okay, so Rafael is just joining. Hi, Rafa. So I am the chair of the Working Party on the environment for WONCA. And it's a pleasure to have you all. I'm just gonna contextualize our side event a little bit. So last year, the Lancet Countdown came out with a fabulous report on how climate change affects health. And one of the points they made was that it's very significant how meat production is related to greenhouse gas emissions and how it's a very important driver of climate change. So I was also very impressed about the evidence shown there that meat, steak, especially cattle meat, is related to cancer and other diseases. So we started a discussion in our working party, and which was then led by Laura and Shireen. We basically discussed about the evidence that is it robust that meat is not good for us in excess. And Laura and Shireen have shown us a lot about the evidence, and they will help us understand the relations between the environment and health concerning meat and the planetary health diet. But before that, we're going to have Anna, who is our wonderful family doctor from Brazil, young doctor, and hosting this Zoom conference. And she's going to tell us a little bit about the people that submitted some answers previously to our working party on how they eat. Are they plant-based diets or meat-based diets eaters? So with you, Anna, please.
Hello, everyone. It's an honor to be here. And well, in the inscription form, we asked just one single question. And it was about if people are following a plant-based diet or not. Everybody that had this form, that answered this form, just kind of 90% had answered that yes. Just 10% still not in a plant-based diet. So we have here an addition of mainly plant-based diet person. So I think it's this only.
Yeah. Well, thank you. Thank you, Anna. I think also a lot of people that enrolled are health practitioners. So am I wrong, Anna? I think so. Yeah.
50, yes.
50%, yeah. So that's also significant. Just to have a general look at the audience and people that will interact with us. So it's not people that don't know about the subject. On the contrary, it seems that people have already studied, maybe even more than I have, probably. I'm new to this subject. So now we're going to have Shireen present. Then we have Laura. Then I will discuss some issues. Then we'll have Anna. And just so that I don't make grotesque mistakes, I'm not going to describe exactly your curriculum. So please, when you start, Shireen, just give a quick introduction about who you are and what your area is, and would you mind? Yes. So it's up to you. Thanks.
Thanks very much. Thanks very much, Enrique. Thank you, Laura, for inviting me to share this opportunity with you. And thanks all for being here. So my name is Shireen Kassam, and I'm a hematologist in the UK. But more and more of my time is spent on providing education and advocacy on plant-based diets here in the UK. And that's how Laura and I have worked together over the last year in trying to increase the momentum and shift of health professionals over to a more plant-predominant diet, and providing the evidence and the resources to back up that decision for themselves and obviously hopefully for patients as well. So I am founder and director of an organisation called Plant-Based Health Professionals UK, which is an education and advocacy group. And then just recently, Laura, my friend and colleague, and I have set up an organisation called Plant-Based Health Online, which is a lifestyle medicine service geared to support patients to make healthy lifestyle choices, including a transition to a plant-predominant diet, in order to prevent and treat chronic illness, but of course for the sustainability of our planet too. So I'm afraid I'm a bit of an imposter here today, as I'm really officially a hospital cancer doctor and not a family doctor per se. But I think it's our view that it's the duty of all healthcare professionals to advocate for climate health. And in the words of Dr. David Katz, a public health physician that we all admire greatly in the UK, he states that you cannot rightly call yourself a health professional any longer if you don't advocate frequently and fervently for the health of the planet. So we are all here today because we understand that there are no healthy people on an unhealthy planet, and we for sure do not have a planet B. So why the focus on red meat specifically? And just to clarify, here we're referring to both processed and unprocessed red meat, and specifically to beef, lamb, goat, pork. And it's because its elimination from the diet globally would have enormous benefits for both human and planetary health. So I'll start with the environmental considerations first, and apologies, I'm sure you all know these facts as it appears that we're speaking to the converted, but just to summarize, 80% of global farmland is used for meat and dairy farming. The entire food system is responsible for up to 1/3 of greenhouse gas emissions, and that's from a Nature food paper just recently published. And more than half of these emissions generated from producing food is because of the production and consumption of animals as food. And the most contributing foods to the greenhouse gas emissions are the consumption of beef and dairy. Because when you look at the emissions just from cows and the production of beef, this amounts to 50% of the emissions from animal agriculture, because it's 20 times less efficient to raise cows for food than it is to raise and farm beans, for example. It takes 20 times more land to produce a calorie of beef as it does a calorie of beans. And we've heard this often, but the emissions from animal agriculture are greater than those from all forms of transportation combined. And of course, it's not just the carbon emissions from animal agriculture which are a problem, but the methane from ruminant animals, which of course are the cows, sheep and goat. And it's also the nitrous oxide from fertilizer and manure. Animal agriculture is not only just producing greenhouse gases, but is a major driver of habitat destruction, land use change, water and land pollution, biodiversity loss, and species extinction. Our reliance on meat consumption in general is just hugely inefficient, with livestock farming producing only 18% of calories and 37% of protein globally, despite the fact that it takes up 80% of farmland. So the food animals we consume are actually themselves consuming more calories and protein than they're producing for human consumption. For example, farmed animals consume between 6 and 12 kilograms of plant protein in order to produce just a single kilogram of animal protein. This means that we're currently producing enough food to feed at least 2 planets. Yet, if we all transition to eating a meat-rich diet typical of the 20 most industrialized countries, we would need 7 planets to produce enough food. And the sad fact is that middle and low-income countries are increasing their red meat consumption as people move from lower socioeconomic means to sort of the middle class. And red meat production, of course, is amongst the most inefficient ways to produce food and one of the major factors that keeps nearly 1 billion people in this planet in hunger. So just simply swapping out beef for beans is a really simple strategy for mitigating the climate impact of our food system. And just this single food substitution was shown in one study to achieve up to 70% of the reductions required to meet the US greenhouse gas target back in 2020. So just moving on to the health impacts of eating red meat. The negative health impacts of consuming both unprocessed and processed red meat are now irrefutable. As Enrique mentioned, processed red meat is defined as a group 1 carcinogen by the WHO. That means that it actually directly causes cancer. And red meat is a group 2 carcinogen. It's a probable carcinogen. And this is mainly with regards to colorectal cancer, which carries an enormous global burden and one which is expected to increase by 60% to more than 2.2 million new cases and 1.1 million deaths by 2030. Yet if we removed red and processed red meat from our diet, we could eliminate around 20% of these cases. And of course, it's not just colorectal cancer. Red and processed meat has been associated with increased risks of breast cancer, prostate cancer, pancreatic cancer, and many head and neck cancers, just to name a few. In addition, we know that red meat consumption significantly increases the risk of cardiovascular diseases, type 2 diabetes, overweight and obesity, and dementia. And it's these same diseases that have been highlighted in the last year or so in the global pandemic, because individuals with these underlying health conditions are faring so much worse with the pandemic virus and are much more likely to be admitted to hospital, go to ITU, and ultimately die. Yet if we removed red meat from the diet and replaced it with healthy sources of plant protein such as beans and nuts, we could reduce the risk of heart disease by at least 30% and reduce the risk of type 2 diabetes by up to 50%. And when you look at the literature, all the healthy and therapeutic diet patterns actively limit or avoid red and processed meat, replacing them with healthy plant sources such as beans and nuts. And this includes diets that we're now very familiar with, such as the DASH diet, originally created to treat hypertension, the Mediterranean diet, and also the vegetarian and vegan diets. Because we should remind ourselves that the Planetary Health Diet, described by the Eat Lancet Commission back in 2019, states that because the intake of red meat is not essential and appears to be linearly related to total mortality and risks of other health outcomes in populations that have consumed it for many years, optimal intake might be 0 grams per day, especially if replaced by plant sources of protein. Now, I just wanted to mention briefly some differences between high versus middle and low income countries and meat consumption. Now, once again, the Global Burden of Disease Study Group and the Global Nutrition Report, which is published every year, considers 0 grams of red meat as the optimal level, because any intake above this contributes to an increased risk of chronic illness. And yet we have country-based differences in the consumption of red meat. So for example, in the UK, the government recommend that we consume 70 grams or less of red and processed red meat combined per day. When we look at what the UK public are actually doing, on average per capita, we're consuming 38 grams of red meat and 55.4 grams of processed red meat per day. I was quite shocked to see that we're actually consuming more processed meat than actual red meat, which is even worse for health. I'm thinking about Brazil, which obviously is hosting the event. You are consuming 68.4 grams of red meat per day and 8.2 processed red meat grams per day. And so the total amount is about the same as the UK, and unfortunately rising from what I understand from the statistics, but it's mainly unprocessed red meat. And then if you think of a country like India, you know, has been traditionally known as vegetarian, per capita, the red meat consumption is only 3 grams per day and processed red meat 0.8 grams per day. So there are wide variations in different countries, yet the commonalities show us that we're not eating enough fruits, vegetables, whole grains, legumes, nuts and seeds, the only foods that are associated with good health and with the prevention of chronic disease. And once again, the Planetary Health Plate from the Eat Lancet Commission states that red meat is not necessary, but if it's eaten, it should be less than 100 grams per week, which is less than 1 medium beef burger patty a week. And so all regions around the world are above this recommendation, except for South Asia and Sub-Saharan Africa. Now, we'll be familiar with people suggesting that in low-income countries, perhaps more meat should be added to improve the quality of diet because nutritional insufficiencies are still a problem. But this really misses the point about the true drivers of poor health. In many low-income countries, just as in higher-income countries, both poverty and the abundance of processed foods are the main barriers to transitioning to a healthy diet, plus the lack of food diversity and food security. Diets are often centered around polished rice or over-processed wheat flour with higher intakes of oil and sugar, yet insufficient focus on legumes, fruits, vegetables, and nuts. In addition, cropping systems have become less and less diverse and more based around poor quality cereals. Legumes, fruits, vegetables are more expensive and don't generate as much income for farmers. And farmers are also exporting an increasing amount of the food that they grow. And so this lack of diverse farming is in part due to the value of food not being appropriately costed and a poor level of nutritional education and information. In addition, farmers are being demanded to produce more and more cheap food, and legumes and other more nutritional plant foods are not valued appropriately, thus bringing in less income. So really, the poor nutritional status of some lower income countries are a direct consequence of our industrialized farming systems and global corporate food regime, which is not geared towards the health of human beings and the planet, but rather to corporate profit. Which brings me to the final point, because I don't think we should be falling into this trap. Now, I've noticed that this conference is being sponsored by Beyond Meat, and there is a rise in the support from many sources in the alternate protein or fake meat industry. And fake meats are not the solution in my view. It just perpetuates the issue with our industrialized and processed food system and further disempowers and disenfranchises farmers, pushing them further into poverty and moving them away from locally produced and diverse food systems. These products also serve to suggest to consumers that removing meat from the diet requires an alternative solution, whereas the fact is we should be informing ourselves and consumers and our patients that we actually have all the foods we need to create good health for people and the planet, and we need to support our farmers to be producing fruits, vegetables, whole grains and legumes. Because based on current trends, we will just end up transitioning away from meat to processed and fake meats, which will not maximize the potential for healthy diets to reduce chronic disease. So I would like to end by calling upon WONCA and many other global health organizations who have already endorsed the Eat Lancet recommendations to move the community of healthcare professionals to actually take action. We need to start by individually acting to change our diets, and then we need to support our patients to do the same. So let's start removing red meat from the diet and endorse the Planetary Health diet. Thank you.
Well, Shireen, well done. Thank you very much for this awesome contextualization of the environmental impacts and health impacts of red meat. This is great. And let me just contextualize a little bit more. So WONCA, the World Health Organization of Family Doctors, actually represents over 500,000 family doctors around the world. So it's a pretty impressive number, and I think that we should look into endorsing the Lancet EAT Commission report, as you suggested. Now let's pass it to Dr. Laura. Laura, please, may I ask you to briefly introduce yourself before you start the presentation? Thank you, and please.
Thank you, Enrique, and I'm really glad to be here, and thank you, Shireen, for making the message and the call to action so clear. So my name's Laura. I'm a GP and lifestyle medicine physician. I'm based in Glasgow, Scotland in the UK. I'm also here speaking. I'm very grateful to be speaking as in my role as medical director and co-founder of Plant-Based Health Online that Shireen described earlier. So I really wanted to start at the beginning of my own personal journey 5 years ago when I was diagnosed with thyroid cancer and high cholesterol. And I mention that because it really made me reevaluate my own diet, as well as what I had learned in medical school, in my GP training, and working as a GP in the UK and in Canada. And what I discovered was that there was a really overwhelming amount of research that connected diet and lifestyle with cancer and high cholesterol. And that kind of nutritional education that had been missing from all my time at that time, 15 years of medical education. But through this research and through overhauling my own diet, as well as advocating for patient dietary changes, I discovered that food and our food choices had a huge impact on planetary health as well. And this has become a subject that I feel really strongly about, which is why I'm here talking about it today. And I also have quoted David Katz, who Shireen described as a favourite physician of ours, who mentioned that we rely on the health of the planet for our own health, and that indeed there will be no healthy people without a healthy planet. And I think this is so true. So I have now been advocating for my patients to cut out, or at very least reduce, meat along with other animal products in their diet for almost 5 years now. And I'm always amazed but never surprised about the just incredible results that I see. So I see patients being able to reduce their blood pressure, reduce their cholesterol, their A1C levels, for example. It really is quite incredible. And what I found is that patients are also very open to the idea that food can really change their health trajectory, as well as the fact that they are motivated by climate change to do so. And this is not just young patients who are maybe more aware of planetary health issues, but also the older generation who maybe are more mindful of their grandchildren and their future, for example. So this way of working for me feels really rewarding, and it's very satisfying for my patients as well. But it can feel like very slow work, changing one patient at a time. I often feel like I'm in the minority, and I come up some resistance against my colleagues. So it feels extremely important today to be able to discuss this amongst like-minded professionals. But the truth is that the majority of doctors across the globe, despite their many years of studying in medical school, have very poor education on nutrition. But most people do agree that medical practitioners should be providing nutritional evidence. And so we really do need a better understanding of how our food choices affect our own health, our patients' health, and the health of the planet. However, only a minority, so 26% of doctors are confident in counselling their patients on nutrition, and as such are really advising dietary changes very infrequently. I want to suggest that advising our patients to cut down on red meat is a basic message that we're all very capable of grasping. As doctors, we're very used to learning quickly. We only need to think about the past year in the pandemic and how much we've learned about COVID-19 in just over a year. We really are very capable of taking this message on board and applying it in our everyday practice. At the same time, I want family physicians to realise that they're already having really relevant discussions with our patients, and we just need to extend our conversation to include the issue of red meat and planetary health. So for example, with COVID-19, I expect that this topic is coming up really frequently, and I suggest that we can use this as an opportunity to discuss the relevance of the underlying health conditions associated with more severe COVID outcomes like Shireen mentioned. Conditions such as high blood pressure, heart disease, type 2 diabetes are all conditions that you've heard are closely linked to the consumption of red meat. And so if we were to take this a step further to discuss it with our patients, we could openly talk about how global demands for meat are destroying natural habitats and perpetuating zoonotic diseases. Now, I realise that this could be a lot to discuss in a short consultation with a family doctor, but there are things that we can do, like handing out flyers and signposting our patients to relevant resources. This is a normal part of our consultation practice already. Another important issue is around antibiotic resistance, and this is something that we should be talking to our patients about, and if we're not, then we need to start. The UK 5-year antimicrobial resistance strategy reported 700,000 lives are lost globally from antibiotic-resistant infections. And this number is projected to reach 10 million deaths by 2050 if we don't make any changes. And to put this into perspective, this number surpasses all cancer deaths. So I'd expect only a small number of patients to be aware of the fact that improper use of antibiotics in animal agriculture has been confirmed as one of the main driving factors for antibiotic resistance. And whilst reducing improper use of antibiotics in agriculture is key, reducing our demand for meat offers a very real part of the solution. In fact, I read a study just before we started this evening, which confirmed that cutting down to 40 grams of meat per day does have a really considerable impact on antimicrobial resistance. In fact, it's thought it could reduce global consumption of antimicrobials in food animals by as much as 66%. And this reduction is comparable with what could be achieved through regulations directly targeting the use of antibiotics in food animals. Consumption and reduce demand, we will need to raise fewer animals for food, and this will help reduce the number of antibiotics used in food animals. So I think to raise the conversation on these two topics is a very sensible link when we have these discussions with our patients. On a slightly different note, here in the UK, there's a growing movement for social prescribing, spending time in nature and gardening and getting our patients to grow their own vegetables, for example. And so it was really interesting for me to read about the task force convened by the Planetary Health Alliance just in the last year or so. And they came together to suggest 5 domains, but their first and foundational domain for planetary health education was interconnection with nature. So I think that we really need to work towards helping our patients understand the importance of nature, to care about the destruction of the planet, and also to find compassion for animals. Thankfully, I think that our patients still respect and trust us as their doctors, and certainly think that the advice and information that we provide is credible. And there have been focus groups which confirm that patients really are expecting their GPs to give them dietary advice. And so despite what I said earlier about many doctors not having adequate nutritional education, I think that they are really able to learn this information quickly and provide evidence-based dietary recommendations. And there is robust evidence, as you've just heard from Shireen, with regards to the benefits from eliminating or at least reducing meat. And there's no doubt that this recommendation will benefit both our patients and the health of the planet. And I think that we need to work really hard at this. Our patients expect to receive nutritional advice, and if they don't hear it from us, they have unsolicited, unlimited supply of nutritional information from the internet and from social media, for example. So I think it's extremely important that we are able to deliver consistent messaging, unbiased and evidence-based advice. And we should, as I alluded to in the paper that I wrote for WONCA, keep in mind our patients' cultural backgrounds, religious backgrounds, and this is something that we should be doing anyway when we are delivering patient-centered care. So I found that shifting my focus to helping my patients change their diet and change their lifestyle, and that by doing so, I'm working much more in partnership with my patients. Instead of before with a much more allopathic approach, working with in a more dogmatic fashion. And I think that this is a really powerful way of empowering our patients and facilitating behavioural and dietary change. And again, as I mentioned earlier, patients are really open to this and really receptive to the message that they have control over their health, and that by making dietary changes, they can often reduce or come off or sometimes even prevent the need for medication. I think this is especially relevant just now as we deal with the backlog of medical issues as a fallout of the pandemic. And we were already overwhelmed with chronic disease management, and preventative medicine has already been falling somewhat neglected. But we do know enough, and we know that following a healthy diet can really improve health outcomes. And cutting down on red meat, or ideally eliminating it, just offers one of the most dramatic ways that we can do this. We do, of course, need to consider the barriers that our patients have and discuss this with them. And certainly one of the main and most commonly cited barriers for patients increasing their fruit and vegetable intake, for example, is affordability. But that being said, beans and legumes are often some of the cheaper foods found in the supermarket. And it would also be my suggestion that family doctors advocate for subsidies for such types of healthy foods, as well as increasing taxes for unhealthy foods and damaging agricultural practices. A similar scenario was effective in Mexico in 2014. Taxes for sweetened drinks were introduced, and I believe that the outcomes were favourable. So whilst educating our patients and increasing their awareness around this topic is really crucial, it's not always as simple as telling them just what to do. And there are some things that I think that we can do to facilitate change. And the first and one of the most important is role modelling. It's well established that doctors have a positive influence on their patients. We can lead by example, as Shireen suggested, and remove meat from our own diets. And I think, in fact, this is really important when we consider that physicians' own personal health choices have been shown to impact our patients' care. We can set unspoken standards for our patients, and research has shown time and time again that you are more likely to counsel your patients on behaviours that you yourself are familiar with. So, for example, physicians who don't smoke are more likely to counsel on the health hazards of smoking. Physicians who eat more fruits and vegetables are more likely to counsel on nutrition. And I would expect that physicians who are more aware of the health and environmental dangers associated with red meat are far more likely to counsel their patients on this too. Dr. Erica Frank looked at physicians and their practices of self-disclosure, and what she found was that patients involved in her studies rated their physicians to be more believable, more motivating, especially when it came down to them offering advice and details about their own diet, for example. And it goes for the opposite too. If we choose poor health habits, or if we don't start to make these healthier changes in our own lives, and then this could have a really negative impact on how we counsel our patients. So I mentioned before that making change one patient at a time is very slow, but it is really, really important work. However, I would suggest that when we make these changes in our own lives and we feel our own personal benefits, as well as witnessing the success in our patients, we're much more likely, as I am just now, to speak out about it with colleagues at conferences and webinars. But these changes do take time, and I would suggest that whilst we're working on this, we also start to demand from our government and policymakers to help our patients make better food choices. I think it's really important to say at this point that you don't have to be following a perfect whole food plant-based diet before you start having this conversation with your patients, and certainly being very open and honest with them to tell them that it's something that you started to learn about or something that you're starting to try, and can actually be very motivating for them and allow you to connect with them on a very human level. So just on the last kind of topic that I wanted to cover was the ethical side of things. And we can all agree that as healthcare professionals, we have to work with integrity and compassion. We should always be guided by our ethical codes of practice. And I think that this is really relevant to our discussion today. And the first way I see this is that in the past, we've been taught that chronic diseases are exactly that, something that our patients have to live with all day, every day for the rest of their lives. But there's an abundance of research showing that many of these common chronic diseases are in fact reversible. And I'm thinking about type 2 diabetes in particular, which is not only preventable in many cases, also reversible with a whole food plant-based diet. Indeed, last summer, maybe the summer before, I'm losing track of time, the American College of Lifestyle Medicine released a position paper on type 2 diabetes and how it was connected with reversal with a whole food plant-based diet, and suggesting that this is the clinical outcome that we should all be striving for. And so I think that this really challenges how we think about chronic disease, and that if we're not offering this to our patients, if we're not offering a prescription for a plant-based diet and the chance of clinical remission, and we could be considered to be practicing unethically. The second ethical point of view really comes from the fact that many livestock practices raise very important ethical concerns. And if we're really encouraging our patients to avoid meat in their diet, we're really helping them reach for a more compassionate way of life, which I think is very needed just now. I think this is something that we can really offer all our patients. It's true that for some it might not be as accessible as others, and they might not have the means for a variety of different reasons, but I think that just places more responsibility on the majority of us who can make these changes. So I hope after this discussion that you can see that the message is very clear, and we should be advising our patients to cut red meat out from their diet. I don't see this as extreme or unfair. It just feels like the right thing to do. And if we care about our patients' health, and I'm sure that we all do, and if we care about the planet, and I think we all do because we're all on this Zoom together just now, then we need to recognise our responsibility for delivering this evidence-based message and to cut down, ideally cut out red meat. And if we do this, we'll be offering our patients a really sustainable approach to optimising their health, as well as protecting the health of the planet. Thank you.
Laura, brilliant, brilliant. Of course, I had read the paper that you prepared along with Shireen, but hearing you is much more powerful. So congratulations. And as Olga said here in the chat, I congratulate you and thank you for making the connection of your current work on plant-based diet and some of your life experiences. So thank you for sharing with us. I think that sharing our stories and what motivates us is a very powerful way of stimulating transformative change that we need so much. It's time that we be true to ourselves and help people understand that we need to change in a positive way. So now I'm going to present my story and how I've been dealing with this. That is red meat and planetary health. And so I just before that, I just wanted to say my mom is on. Actually, this Zoom is offered by her from her institution. So this is not merchandising, it's just thanking her institution, which is the INFAPA, the Institute of Family Therapy of Porto Alegre, which is the southernmost state of Brazil. So thank you, Olga, and your team. So that is because WONCA is such it's a giant institution, but very poor. And I don't mind that because when we make our connections, they're really out of generosity, love, and compassion, and very nerdy and geeky people that like to study and communicate science. So this is what we feel here. So very reliable people. So before I go to my story, I just want to talk about this little bow tie, which I was very shy to use, because usually I see that in very, very good professors. But I got this from my wife. She brought it from a trip to Paris, a study trip. And my little kid, 7-year-old, said, "Dad, why don't you wear the bow tie?" So I had to wear it. So I'm sorry, guys, I'm wearing it. And so we have to cope with this. So here's the picture. Let me see if I can present my slide. This is just one slide. So share. So this is just to show where I am right now. I'm in my house. Can you guys see my my mouse little arrow? Yes. So this is a church, and my house is around here. My clinic is down here, and this is my tiny little town. We're just over 6,000 people. So this is one agglomeration of people, maybe 500, 1,000 people. And then we have other villages between the mountains. And we actually have around 14 villages. And when we add them together, we get up to 6,000. So it's quite rural. You see a lot of forests. And we are gauchos. And that means, well, that means I'm not going to present that. Let me just erase that. So that's back to my face. I'm sorry about that. But so we're gauchos and we love red meat. And I'm here for more than a decade now, 11 years. And what I thought of red meat was mostly related to deforestation and loss of biodiversity, because I have some background in ecology. And I started talking about this with my patients, which are mostly Catholic, some years ago, because he published his vision on planetary health, which was healthy people, healthy planet. And so I discussed this when spirituality was appropriate in the consultation, and when it was appropriate to talk about red beef especially. But I was not sure about the evidence on health until we came across this Lancet countdown, and I knew about Lancet Eat. So this is a big issue for me. So even if you don't know about the health implications, spiritually, I think it's appropriate already to talk about this as a family doctor. And why am I saying that? As I invited other family doctors to participate in this, I was challenged by one of my best friends and one of the most brilliant family doctors that I've known. And he was actually a pretty high up health official in Brazil. And he said that it was not cost effective, and it was not the role of family doctors to talk about red beef, red meat. And I was just really blown away by this, because I respect him so much, and he's really good with epidemiology and evidence-based medicine. So, of course, I knew some of the evidence because I helped with the Lancet Countdown Brazil, and we had already mentioned deforestation and loss of biodiversity and zoonosis in health in that paper, but his reaction is something very important to me. And I feel that if we are to make a call to all doctors to clearly make that point to our patients, we need to be able to communicate to these doctors that are excellent clinicians, but don't understand the evidence and how to put it in appropriately in our conversations with patients. When we have such an overburdened primary care providers reality, we are overburdened. And, you know, it's just, how can we squeeze that in? Is that squeezing? So that's one of the questions that I wanted to make. But I've been trying to squeeze it in, and I've been calling it sort of 1 minute for the planet in the consultation, which really takes less than that. So, so it's and then I started trying to associate that with other diseases, and especially when people come for checkups. So that's mostly after Laura and Shireen started to develop the paper for us. So just to mention that I'm very happy to say that I contributed to the paper you mentioned, the Lancet Education Framework, Lancet Planetary Health. And I helped with interconnection within nature. That is to say that we are nature, just as simple as that. So if we really hurt nature, we're hurting ourselves. That's very consistent across the board. Very interesting. And now I want to pass it to Anna, who is our wonderful host. And she is a young family doctor. And we've discussed this plant-based diet, planetary health diet. And I think that one of the ways to feel comfortable with making a call that is a WONCA call, if we pass it, is to listen to young doctors. So I think that it's very nice to listen to Anna, which may be the youngest doctor around we have. So please, Anna, do go ahead. And first introduce yourself. Thank you.
Thank you, Enrique. Thank you very much. So I'm Anna, and I'm on the second year of family medicine residence in Grupo Hospitalar Conceição, working on a health center in Porto Alegre, South Brazil. And Enrique invited me to make a statement about my experiences in a young doctor about reducing red meat in the clinic. So as a young doctor that concerns a lot about planetary health, and as a person that follows a plant-based diet, I always manage to approach the subject in every opportunity that opens. It's not easy to propose that habit change to anyone. Generally, I try to do that in a positive way, guiding people to enhance vegetables and fruit consumptions first, encouraging them to know the products and pleasing curiosity, stressing that we have a street food market in the territory, that they can find it more, they can find more variety and cheaper prices, and encouraging people to grow their own food when it's possible. And when I was thinking about my place and in this concern, there is something that I think it's a gap in the medical education, that is the approach to the advocacy role of a doctor. Even in the family medicine formation program, advocacy happens to be a taboo, and we don't have the opportunity to develop this ability, if not by our own personal interest. I'm just getting familiar to this topic now, getting involved with planetary health, and particularly in Brazil, and most of all in this political moment we are living now. It's a greater challenge. So I was thinking how we can introduce the advocacy, the whole to advocacy in the medical school, in the residence programs, that is so important to planetary health, to protecting our future in this planet. And I was also having this idea to my first advocacy plan is to maybe start a campaign in the health service with the professionals to have a meat-free Monday, to talk about meat-free Monday, and maybe start to talk about it with my colleagues and see what happens, and start discussing that with the other doctors in the health center, starting small and maybe spreading it to the community broader than my own room. So this is the ideas that comes up to me now after this discussion, and I'm very happy to be here and to have this opportunity today. Thank you very much. I'm passing now to Enrique to the questions and answers.
Ana, thank you very much. So I guess beautiful story, and I've known Ana for maybe a couple of years. I think you were still in medical school, and it's awesome to see how you're developing into a planetary health practitioner and activist, which I think you're already. So welcome. It's not easy, but it's beautiful and very fulfilling. And now I guess we have to take questions and answers. I think we have about half an hour. That's quite a lot. We had some questions here that Shireen was very kind to answer. Maybe we'll wait 1-2 minutes so that our speakers can have a glass of water, and we will start to answer questions. Let's see if we get questions. If not, I'll try to bring back the questions that we had before. Yes, so everyone get a glass of water. We're waiting for questions. And again, I'm going to ask our presenters to help me with the questions that come in, because it's not that easy to look at the chat and talk. So Rafael is asking, what is the paper that we have prepared? Laura, would you like to respond?
Yeah, thanks, Enrique. I think Shireen already posted it in the chat, the PDF. But this was, yeah, he did. She did, sorry. Yeah, this was the paper that kind of prompted this meeting, this side event, which discussed the detrimental impact on health and also planetary health, as well as the role and responsibility of the family physician. But I think he has it there so he could read it.
Yes, so let me just say that we haven't published it yet. So just please do keep it. You can share it with colleagues, but please do not, I don't know how to say it, just keep it discreet, yes, because I think we're still working on it, Laura, and we can actually pass the link so people have, perhaps you want to do that, Shireen, pass the link so that people can make comments and all, but just to make sure that we're still working on it, and we'll look for a place to publish it and to support a WONCA call to action on planetary health, diet. Please keep that discreet. I think that we're getting some questions here. Let's see. Rafael, I would like to explore the impact of dairy and eggs. If you could talk about this. I suggest you talk about some challenging cases and how you helped change their diet. How do you cope with anxiety of starting a whole new lifestyle and worldview in both personal and professional ways? So I guess we have two questions to start. Shireen and Laura, I guess you see the questions here on the chat, right? So maybe you want to choose one of them or two and start answering. Okay?
I don't mind starting with the dairy and eggs, if that's all right, Laura, and then I might ask you to talk about a challenging case. So does that sound okay? Yeah,
of course.
Yeah. So just in terms of the impacts of dairy and eggs, I guess it's, looking at the health impacts and also the environmental ones. Now, we know from dairy production that, again, the fact that involves farming cows are really creating and producing, greenhouse gases in the same way that beef consumption does, to a lesser extent, of course, but again, dairy production uses a lot of land and water resources particularly, and then that has the knock-on effect for biodiversity and land degradation as well. Although increasingly, I guess, dairy production is produced in CAFOs or factory farms, whatever you want to for these operations. So, you know, we know that dairy consumption or the production and consumption is having adverse impacts on the environment. And then you have to think about, well, is it actually necessary in the diet? There's a really great paper I'll post in a minute when I finish talking in the New England Journal of Medicine, co-authored by Walter Willett, one of the greats of nutritional epidemiology, called Milk and Health. It's a really straightforward title, and it clearly outlines all the data we have regarding dairy and health, and they conclude that there is no evidence for the requirement for dairy in the diet. We have to understand that 70% of the global population don't have the ability to digest lactose beyond weaning because it's not essential. It's really a European trait of lactase persistence. And in many cases, dairy is contributing to ill health such as allergies, eczema, asthma, etc. And there's increasing concern about increasing rates of prostate cancer in men and in driving other hormone-related cancers such as breast and endometrial cancer in women. And despite the message we're sold by the industry, there is no correlation between dairy consumption and bone health, and in some populations quite the opposite. The more that's consumed, the rate of hip fractures, particularly in women, and that was from studies from Sweden. So it's not necessary in the diet. You can obtain all the nutrients you need from other foods, plant-based foods, and it's detrimental to the environment. Now, eggs, I guess, you know, lower environmental impact, but you just have to think about the operations that are in place to produce eggs. You know, even though we talk about animal welfare and creating space for chickens, the reality is that we crowd in, you know, millions of poultry birds into a very confined space, and that creates just the perfect conditions for transmission of infection and the requirement to use antibiotics, for example. And, you know, the next predicted pandemic by the WHO is the H5N7 bird flu. And we're already having bird flu outbreaks in the UK, resulting in culling of millions of birds. So, you know, even though we sort of think about eggs as not having a big sort of environmental impact in terms of the land use and the water use, for example, there are risks associated. I can talk from Europe point of view. Salmonella infection from eggs and poultry is one of the biggest causes of foodborne infection, for example, and increasingly these infections are antibiotic resistant. So again, we don't need egg consumption. We think of it as a good source of protein and vitamin D and various other nutrients that are so much better obtained from plant sources. And every study that's looked at plant sources of protein and compared the health outcomes to those consuming animal sources, regardless of whether it's red meat, white meat, eggs, dairy, beans, nuts, seeds, etc., come out on top for the health impact. So I would suggest they're not necessary. They're better choices we can make for health and the planetary health as well.
Excellent. Laura, we actually have many other questions coming in. Do you see the questions?
Yeah.
Anna, would you like to collaborate as well?
Yeah, I see them. I was too busy listening to Shireen instead of thinking about my answers. But I think somebody asked about any challenging cases, and I think that's probably worth spending a few minutes on. I mean, I do consider myself really lucky now, because I think that when patients come my way, they kind of have learned what to expect from their consultations, that I take a plant-based, you know, food first, lifestyle first approach with them, and so they're not surprised when the conversation about a whole food plant-based diet comes up. But before that, yeah, I have come across many patients who are very resistant to the idea, but what I've fallen back on is my relationship that I have with them as their family doctor, and knowing that I can make the most of every opportunity that they come to the consultation room, and that also I'm able to follow them up. So Enrique, you kind of alluded to the fact that so many physicians are overwhelmed and overburdened, and we have short appointment times. But with our patients, we can always follow them up and see them again. And so with challenging cases or people who are resistant to the idea of dietary change, you just need to plant the seed and then follow up and keep the conversation going. And I found that that has been a really powerful way of kind of opening up people's minds and ideas to this topic of plant-based nutrition. There are some things, Enrique. There are some people who just, not many, but some people who say they would rather eat their bacon and drink their soda and have a heart attack, and that would be fine. But you know, the majority of people I find are really open to this idea that food can have a really positive impact on their health and also the health of the planet, where that discussion comes up.
Thank you, Laura. I just realized that I didn't ask to record this because this is just so awesome. Are we recording, Anna? Oh, thank you. And are we recording the chat? Because Shireen is just awesome in putting the evidence on the chat. Are we recording the chat?
You'll be able to download the chat when you end the call.
Oh, okay.
I was gonna say that.
Could you, yeah, because if we pass that on to WONCA, I think this would be very, to WONCA executive, if you want to pass on a WONCA call, this conversation and the chat will be very effective, I think. Well, one thing that, listening to Laura comment on my concerns about primary care providers overburden, you know, and the time restraints that we have, I started thinking, okay, so if the administrators of health, how do I say that in English? Does that make sense to say? If the public health officials that pay family doctors, primary care providers, understand the impacts on health of a planetary health diet and the impacts on climate change, and all the money that should be taken from the subsidies of fossil fuels, and all the money that should be made from taxing red meat and so forth. Shouldn't we get a little bit of this funding to give 1 minute for the planet for every family doctor? Shouldn't we pay that for family doctors? Maybe that should be in our call, so that we don't raise the burden in family doctors. I'm saying family doctors because I'm more used to family doctors, but this is really to every primary care provider. Does that make sense? Would that make sense? I guess I'm asking to everyone, panelists and attendees. Anna, would you like to respond to that, or anyone else?
Yes, I would love to do that kind of work and get and be recognized by that. And this is a question of advocacy again, you know, for us to work on that and to bring this to the administration, to the public health services and everything. I agree completely.
We have other questions. So Rafael is asking, is there evidence of the strengthening of the immune system of a certain population that eats more plant-based diet, like in India or Germany? That's a good question.
Yeah, I mean, I don't mind just commenting on that. I mean, I guess there's plant-based and there's plant-based, isn't there? So as I alluded to, in India, there's a variety of diseases. I mean, variety of types of diets, given the huge population. But, you know, one would find that sort of lower income countries, although poorer communities are eating predominantly plant-based for obvious reasons, they're often very monotonous diets, you know, white rice, you know, highly polished white rice with not that much diversity. And that's not the sort of diet that's necessarily going to promote the best health. And then, you know, in India, that maybe some of the richer communities are eating a bit more meat, but also lots of dairy, and have moved away from more traditional diets. I mean, I think there's no doubt that diets that are centered around fruits, vegetables, whole grains, legumes, nuts, and seeds are associated with good health for the reasons that you described, because, you know, we know that 70% of our immune system starts in our gut. You know, we need a healthy gut microbiome to then keep our immune system healthy through the secretion of, you know, short chain fatty acids, their hormone production, their impact on the immune cells, you know, the other side of the gut, but also their communications with the brain and the lungs, for example. So yeah, I mean, there's no doubt that the immune system is affected by our diet. And it's actually exciting in my field of cancer. We're realizing that, you know, even your response to anti-cancer therapies are associated at least with a better gut microbiome, which when you look at what people with a good gut microbiome are eating, it's the whole plant foods, the fiber-rich plant foods. So yeah, I mean, I think intrinsically everything comes back to maintaining a healthy immune system. And when you have a diet that's rich in animal foods and processed foods, you get heart disease and diabetes and overweight, which creates chronic inflammation and adversely affects the immune system, which is one of the kind of pathogenic mechanisms that then leads to the you know, the malfunctioning of the immune system in response to COVID-19. So, I mean, that's a really simple way of saying it, but yeah, for sure. I mean, I think all the micronutrients, vitamins, minerals, etc., are essential for our microbiome and the immune system.
Wow, thank you so much, Shreen. This is really awesome commentary. I think this is one thing that I would not guess. So it's probably new to a lot of people. Good question and good answer. So another question comes from Kiran and Olga. How do you talk to patients to reduce their meat consumption when their belief systems are not very good at looking at scientific data? And Olga sort of put that in, shouldn't we adapt planetary health diets to the local community?
I'll try my best to answer that. I mean, I think it's really difficult when people do have certain belief systems and are maybe not open-minded about the data, which, you know, we've all heard today is irrefutable, I think is the word that Shreen used. But what I find in the kind of practical everyday setting is that even these patients have something that they're motivated by, and they have something that matters to them, whether it's their own health or the health of their loved ones or a pet or something. Like, everybody has something that's important to them. And then when you can discuss that with them and really tap into that, you can usually find a window of opportunity to open that discussion about plant-based nutrition and how to optimize their health, and then linking that in with what really matters to them. At least that's an approach that I've found useful with my patients.
Let me just clarify one thing that might be confusing to some people. So we just have to make sure that we understand that protein is essential. It's a building block, and we need to meet the protein requirements per day. But we shouldn't confuse protein requirements per day with requirements of protein from meat, red meat. That's different. So we have to meet the requirements of protein per day, but that can come from plants. It doesn't need to be from red meat. So coming from my culture, which is a gaucho culture, we don't understand that. We think that protein only comes from red meat. Laura and Shireen, could you clarify that a little bit more? I think that's a very big issue, and it talks about Kiran and Olga's question.
I think Raphael was perhaps referring to whether you can get enough protein from just eating plants, and whether the 0.8 grams per kilogram to 1 grams is too much, is excessive, is it necessary? I think the first thing to say, I guess, is the recommendation is per lean body mass, and I think people don't necessarily reference that. And given that, you know, certainly in my country, 2/3 of individuals are overweight, you know, aiming for 0.8 is based on your lean body mass. Also, there is no way that you are not going to meet those requirements if you're eating a diverse, healthy plant-based diet centered around the foods I've mentioned, particularly incorporating beans, legumes, pulses, chickpeas, peas, tofu, etc. And yeah, that recommendation is a bit high. Most recommendations are a bit high, just to take into account the majority of populations. And you know, but equally, there are studies that have looked at, you know, vegetarian and vegan diets and protein intake, and everyone is meeting those requirements, even those on a vegetarian and vegan diet. So I really don't think we need to worry. The concerns sometimes come with elderly individuals when appetite reduces, and their absorption and digestion of certain foods sort of alter, and sarcopenia is more common because physical activity is less. And then, you know, we are advised, certainly in our European guidelines, to aim for a higher protein intake, which is then a bit more difficult to meet for certain individuals when they can't literally get enough calories in. But there's, you know, there's ways of adapting the diet, and you know, incorporating more beans and nuts and seeds, and putting them into smoothies and things that won't, you know, overly satiate, but will provide the protein. So yes, sometimes it can be a bit of work, but it just needs a bit of knowledge and skills. But I think for, you know, people here, and if you're healthy and eating a diverse diet that's meeting your calorie requirements, protein is really not an issue at all. And as Enrique says, we shouldn't be thinking about protein and equals meat. We should be thinking of the quality of the protein. And there's no doubt that plant protein quality, when it comes to thinking about health outcomes, completely outperforms the protein you require from any animal source.
Hello. Could I add something in this? Is it open for attendees, or yeah? So I'm Vanessa. I'm a integrative dietitian, and I'm doing my doctorate in food science in Rio de Janeiro now. So it's just about this the protein. I mean, we need to remember that the cows only eat grass, right? So in the vegetables, we have all the protein we need. I mean, yeah, especially the amino acids. We have like a few amino acids that they are essentials. It means you don't produce in your body, and you need to get it from there. So we have all of them in vegetables. So this is definitely not a problem. The only thing that I would say is that you need to be more diverse, because like in the meat, it's kind of, you have all the essentials amino acids together. And in the vegetable world, they are kind of split in different vegetables. So the diversity, for this reason, diversity is very important when you take your protein from vegetables. I just put in the chat a really good review about the nutrition and immunomodulation, and it's definitely what Shireen said is totally related. Because especially with the new bioactive compounds that we produce like some metabolites from them, and they stimulate your immune systems in a certain way, especially like the cruciferous, like broccoli and a special kind of
Vanessa.
Yes. It's too
Vanessa,
long.
Yeah, we have to close in a few minutes.
Oh, okay.
So I just wanted to ask you a question, because I think that your point about cows producing all that protein only on grass is maybe very didactic, very easy for education to clarify all the doubts, all questions. But I have to ask you one question. Of course, you know a lot more than I do about nutrition. So my question is, what I know of cows is that at least one thing is very different from the human body, and that is the digestive system. So they have a very different digestive system. And I understand your point, but I'm not sure that the bacteria that play a major role and that produce a lot of methane, which is one of the problems of cattle raising, doesn't that play a role in producing amino acids?
No. We have all the structure that we need to make our proteins. There is okay. Absolutely no problem.
So basically you're saying that the amino acids that are absorbed in the digestive system are completely coming directly from grass, and it's not a role played by bacteria.
Yes.
Is that it?
Yes. Yeah,
and
they are in vegetables.
Okay, and they don't play a role, say, in facilitating the absorption of amino acids.
No, not at all.
Not at all. Okay,
No.
that helps a lot. Would you be able to put a few scientific references to that? Because that's very useful in communicating. That's really straightforward, because I get those questions a lot. Yeah. So obviously that's also enough to answer calcium and bone health. So that's, I would say just that phrase. Okay, listen, cows, do they eat meat? No. Do they drink milk? No. So end of discussion. Next. But
yeah,
I need the
think
evidence.
Shireen just put a paper right now about it. I will see if I can do it on time before it finishes. Yeah, and just Shireen, one more thing, just do it slowly. Everybody's changing habits, even ourselves. Just try to add before taking out from the patient. Like add fruits, add vegetables, add things that they don't, and then just signalize. So, Anthropocene, look at the world, and then because the body, as soon as you start changing, your body helps you out. Even your pupils in your mouth, the taste, it changes. So it becomes easier. So don't worry too much about that. Just start slowly, little by little, you yourself and your patients. Well, I had a lot to add here, but
let me just say that we have to close in respect to the organization and the Planetary Health Alliance, all the teams that are working. We have to close in 3 minutes. So I'm just gonna talk.
I just want to add one point quickly of what
just before you make your question. So we are going to close. Yes. So we are going to.
I'm making a point.
Yes. Just before you make your point, in 3 minutes we are going to close, but I'm not going to close the Zoom. So we make it a corridor sort of conversation, which sometimes is much more productive, and it is going to be recorded, and we'll make sure that we put it on the WONCA environment website. Okay, so please go ahead, Kiran. Go ahead.
I learned something very interesting yesterday, which I Shireen know. Yesterday in one of the talks in this conference, I think it is Brian Frederick from the Good Food Institute. He made a point, he made a presentation, and he came up with a very interesting statement saying that cows do not have the need to make protein. And he also says that chickens cannot make it, pigs cannot make it.
Sorry, Kiran.
Yeah, it's not possible.
We are not listening well. If you can, please, your sound is not too loud. Yes, if you can speak slowly and louder, please.
Yes, Kiran. So yeah, Kiran. So we do have to close. So it's 1 minute to our time. So I'm just going to thank everyone and say that I think this was highly productive. I think that as the chair of the working party on the environment for the World Organization of Family Doctors, I am convinced we need to push for this paper to be published on behalf of the working party. And I will be very happy to be presenting the need for a call for a planetary health diet for family doctors. So thank you very much. And